All right, so we're going to go ahead and start. I know we're a little bit early. This is going to be new for Enlace. We're about 1 minute ahead, and apparently, and again, I want to apologize. If you hear a dog barking, that is my dog. He doesn't understand I'm in a meeting this morning, so he's upset about something. But thank you, everybody. We have about 22 people, 23 people on the line here. We have our 4 presenters. If I'm going to go ahead and let the presenters introduce themselves real quick, and we're going to start with Deputy Chief Estes, because I know you have to leave kind of early. Thank you very much for being online. If you could just provide us with your name, your agency, and then we'll go from there.
Sure. Good morning. My name is Jeff Estes, Deputy Chief of Police at Charlotte-Mecklenburg Police Department.
And if we can start with Faith.
Good morning. I apologize in advance also if my dog starts to bark. But my name is Faith Estrada. I work for the City of Charlotte in Housing and Neighborhood Services. I'm a community engagement liaison.
Thank you. And from Atrium?
Good morning. I'm laughing because I also have a dog that does not understand meetings. But my name is Dr. Mohanan. I'm with Atrium Health in the Department of Family Medicine. My clinical locations are Middle Point, Elizabeth Family Medicine, Maine, and Mercy. Thank you for having me.
No, thank you for being here. And from 311.
My name is Lynette McCallum. I'm with 311 with the City of Charlotte, which is also part of Housing and Neighborhood Services. I am the Partner Liaison Manager.
All right. Thank you very much for being here. I really do. We really do appreciate it. Basically, just to give you a little bit of format, the last board wanted to do something like this to provide information to the organizations that we have represented within our membership base. Right now, we have like the YMCA, we have some realtors, we have the Center of Prevention Services, we have various other organizations, we have the court system, the Head Start, Mecklenburg Head Start, the Center of Legal Advocacy online, and again, we just need to provide, we just wanted to make sure that these agencies have like the most updated and accurate information so they can provide with their consumers. So we're gonna start because like I said, I know Deputy Chief Estes has to leave. Deputy Chief, if you can just provide us like an overview as to what is going on with the COVID-19 on the standpoint of the police department. Few questions that we had wanted to make sure that we wanted to have addressed was that essential workers, do they have to have any type of paperwork or anything like that to show a police officer if they get stopped? And are you stopping and citing people for being out and about? And lastly, how can we as organizations help the police department kind of do their job better in this time of crisis? What should we be saying to our consumers, friends, everybody around us in the sense of this staying at home order? So Deputy Chief, if you'd like to start. I lost him.
Can you hear me?
Yeah, I can hear you now.
Great. Okay. So first, I want to just say how much I appreciate the opportunity to come and speak with you this morning. I don't know why my video is not showing, but that's probably better for you guys. You don't have to see me first thing in the morning. But I do want to tell you from the very beginning, and there's 2 sides I'd like to speak with you about as far as the police department goes. One is external facing, and then second, I think it's important for you to know the internal facing, our employees, so you have kind of an idea of where we are and what we're doing. For the enforcement part, let me just say from the very beginning, we have emphasized and stressed that in order for this to work, as far as the stay-at-home orders and the whole idea behind the public health initiative and orders to stay home to get us through this has been voluntary compliance. So we have to have large-scale voluntary compliance in order for this isolation from each other to help spread this virus to work. We could not, even if we wanted to, go out and enforce en masse this stay-at-home order. So we have to have the support of the citizens. So to that end, what we've tried to do from the beginning is make sure that we educated, we talked to people, that we let people know how important it was to abide by the rules that we are under right now for this pandemic and for this crisis. We found that, for example, in the business front, that most businesses, in fact, 99% of them, as soon as we visited them or got complaints about them, when we educated them, they closed their doors voluntarily. The ones that didn't, after we had received complaints and after they had been warned, well, then we cited, and kind of, I guess, went up the scale of enforcement. We've had to do that very rarely. On the other side of the coin, on the citizens, we've also found compliance once we've educated them by and large. Now, there are outliers, and the outliers are the ones that we're really working on right now through social media and other public address announcements to try to, encourage people to stay at home. Now, where the some confusion comes in is in the gray area. There can be no order that's written that could cover every variable or every circumstance in all walks of life. You just can't write a document that would cover them all. So sometimes people aren't sure. Other times people are sure but pretend like they're not, so they can continue to do what they want to do. And so we continuing along that path that we're warning first, educating, and then if there's direct knowledge and disobedience of the order that puts other people at harm, well, then we will be forced to enforce it. As far as stopping goes, we're not making traffic stops about the order. We're not doing checkpoints and checking papers and that sort of thing because it's really impractical. Really impossible to do with any fairness or any type of rhyme or reason at this juncture. And so because of that, there's no papers that's necessary. If you find yourself out and about and you come in contact with an officer somewhere for whatever the reason, let's say you work in the medical field or wherever, a simple explanation or whatever, conversation with the officer will that's all you need, though that's even then there's no papers to prove that you're going to see your sick grandmother or whatever it might be, or going to work, or any of the other essential items that are listed in the order. Just because the variations are so wide and so broad, it'd be very difficult to try to prove on the roadside what your business is out on the road. So we've seen letters from the beginning that, and people are writing their own letters and making up letters and all of that. So we just want to put everyone's mind at ease that, there is no curfew, there is no time where everyone must be in. And so therefore there's no need for papers, there's no need for traffic stops and that sort of thing. I hope I've covered your question. That was kind of long-winded.
No, that's fine. That's great information, Deputy Chief. One other thing that popped up was that at some of the food sites where they're giving food, providing services like that, people are indicating that they're unsure of getting that services because they see officers there. Can you kind of address that?
Yeah, so where there's food distribution or where there's medical care, you might see an officer there. It really pains me to hear, people fearful of that, though I understand it. That officers are there in general just to provide security for and a welcoming presence, actually, from folks who are trying to get services to ensure that it's done so in an orderly manner. Sometimes in pandemics and crisis, where people are unsure about things, they can panic, and when they panic, sometimes they can make runs on food or foodstuffs or that sort of thing, and we have a responsibility to ensure that in unstable situations sometimes that medical staff are secure and safe in what they're trying to do, And so it's just for a general security type stance for no other purpose. And I really hope that if anything else we get out of today, that you guys can help me spread the word that, you know, you see officers out at help locations, whether it be for food or medicine or whatever, that officers there really are just for their safety and security, and that's it.
Perfect. Thank you very much. We're going to move on, but again, just to remind anybody, if you have a question, please write it in the chat box, and then I will get to that as soon as I can. But I want to go ahead and make sure. Thank you, Chief Estes. We're going to move on to Faith with Housing and Neighborhood Services. If you can provide some information as to your department, what are some resources? What are some things that you kind of feel like the community should know about?
Yes, so again, thank you guys. I'm with Housing and Neighborhood Services, Community Engagement. So I have, if you see me looking, I'm looking at my computer screen because I made some cheat notes. So basically, I know about a lot of things, but don't know about them very well. So I just kind of made some notes about some programs and also have some contact information for you guys. Mauda gave me kind of a baseline of things that you guys might be interested or she felt might be beneficial for the group to know. The first one was Charlotte Works information. I do want to mention that Charlotte Works is not a city, it's not part of the city, it's a private entity, but I was able to have a phone conversation with Shamia Williams yesterday, and I have her contact information, and she also sent me a really neat one-pager with the information that I'm gonna spit out to you guys. It's a lot, so I can send that one-pager out to the group so that you guys have that information. But basically, they provide 4 different services: adult services, youth and young services, business services, and labor market. And that ranges anything from resume and interview workshops, career development, career pathway, program services for in and out of school youth, ages 16 to 24. They help with high school diploma and equivalency, on the job training experiences. So that could be internships and apprenticeships. They also, if your organization is in need of hiring someone, whether it be a CNA, RNA, or you need a social worker or whatever it might be, you can partner with them and they will post those jobs for you on their website for free. And so like as they're training people and certifying people, those people can apply for those jobs that you're posting. So it's just kind of another bridging gap for people who are looking for employment, and then our organizations who are looking to employ people in our communities. And also a really great thing to remember that when we employ people in our communities, we provide better services. So I thought that was really neat. And then the labor market information, they basically provide unemployment and labor statistics, career planning tools, and career pathway mapping, targeted industry research. So it's really a one-stop shop for anything around training, employment, and kind of research and statistics around those things. So again, I'll send out contact information. The one pager she sent, charlotteworks.com is the website. It has a ton of information. It's super user friendly. I did ask her, what this would look like in terms of serving our immigrant and Hispanic population. And while she mentioned that they are open to helping everybody, they are limited to, because they have federal dollars, or they're funded by federal dollars. So they can service people who are residents or U.S. citizens or have permission to work within the United States. And she did mention that they do have bilingual staff, and they do have access to some translation lines for people who are coming in and who need assistance. She doesn't want language to be a barrier in terms of providing services. So I will send out that information later on this afternoon. In terms of my department, Housing and Neighborhood Services, there's a ton of information. I'm going to start with our neighborhood matching grants, which is kind of my area of expertise. Basically, our neighborhood matching grants, they are grants that we award to communities or neighborhoods who are organized for projects to make the neighborhoods better places to live, work, and play. Really, in reality, we give people money so that they build community, so that they build relationships. The great thing about this is that we are looking to revamp the program because right now it functions on an eligibility criteria based on average median income, or not income, excuse me, average median price of houses in the area. But we know that that's kind of difficult right now with the Charlotte housing market. You know, there are some neighborhoods or communities that are back up to $1 million homes that might be struggling. So we will individually look at neighborhoods and assess them individually if we feel like they would benefit from the neighborhood matching grant program. We have one coming up at application deadline on June 1st and September 1st. And we actually have a webinar. We have some webinar trainings for pre-applications on, we have one on Thursday, April 23rd, 6 to 7 p.m. and Monday, May 4th from 12 to 1 p.m. I can send those out. You're able to join in on that just if you want to know more about the neighborhood matching grant process. It's super easy to join. I'll send out that information also in an email. And it's not, if you get onto the virtual meeting, you don't have to apply. It's just like an interest meeting and kind of just some basic information on what the application process is like. And they're also there to kind of help guide through maybe what type of project you'd like to do in a community. With that being said, with that grant, communities or neighborhoods must be organized, meaning they must have an HOA or a neighborhood organization. But I don't want that to be a stopping factor for people maybe applying for those. And I think what I've noticed just from being there is that we oftentimes miss the mark, especially with a lot of our communities where Hispanics and immigrants are, because they're not necessarily organized, but we do have tools and we are here to help them organize. If that is something that they're interested in, we can help them get that process started. There's a really neat toolkit on our website about how to start your own neighborhood organization. And so that can be something that we can start so that they are able to benefit from these grants. Following that, we have our beautification grant. The deadline just passed for that for 2020, but the Keep Charlotte Beautiful program awards up to $5,000 for community beautification projects. That can be litter prevention, waste reduction, recycling, and community greening. So they do provide resources for that. Even if you don't qualify for that, if you guys ever want to do a community cleanup and need, like you need vests, you need gloves or things to pick up the trash, you can reach out to me and I'll reach out to Jonathan, and we do loan you guys those supplies or tools that you need, and just have to return them, obviously. But that is something that is always available, and it's a really great way to just get community involvement. Once the pandemic is over, I'll go to any trash pickup, cleanup. So that's just to get you guys thinking about things that you can do to engage within your communities. Along the lines of that, we also have Adopt a Street. Anybody can adopt a street. It can be families, an individual, a neighborhood, a business. It's just kind of, you get 2 neighborhood or street signs. You have to commit to a year's worth of projects of cleaning. And again, we do provide those cleanup supplies. The other thing we have is the Jumpstart Community Safety Grants, which is a program ran by Lacey Williams. This is specifically focused around certain things: conflict resolution and mediation, crime fighting and prevention, opportunities for youth or parents, family stability, and addressing racial segregation. This has to be applied for by a nonprofit community organization or by an organization that serves some public good. And so you can always reach out to me if you have any questions of what that means or in terms of eligibility criteria, and I can put you in contact with Lacey Williams. You can actually submit applications for up to $1,000 per project in any of those lists that I mentioned, up to $50,000 per cycle. So that's a lot of room for opportunity in terms of project. And I mentioned the broad categories, but there's so many projects that people have done and been creative in doing so. So definitely reach out to me in terms of that. And then of course, on our website, we do have resources for emergency assistance. Of course, the information for 211. Right now, there's a line if you are or if you know someone who might be experiencing homelessness or will become homeless in the next 14 days, they are able to reach out to that 211 line. The crisis assistance ministry, I don't think is up and running right now, but 211 again would be the place if you need assistance with rent or utility payments. They can kind of point you in the right direction. When things go back to normal though, crisis ministry, assistance ministry would be the person that you reach out for that. And then we have emergency repair services. There's a broad, I mean, that could be your HVAC system, if a roof repair. There's a little bit of criteria and eligibility requirements for that also, but that is available and a lot of people don't know about it. And then there's also special services with individuals or families living with HIV or AIDS. I know I just threw out a ton of information. Like I said, I'll send out an email with some links, my contact information. I am the liaison, so if I don't know the answer, I can try to find it for you, or I can put you in contact with someone who will know the answer. So definitely feel free to reach out to me.
Thank you, Faith. And that was great information that you did throw out at us, but definitely send that information out to the Enlace Resource Hub. So that way, because I've gotten a few questions asking about the Charlotte Works and your contact information. So definitely, if you can, to send that out this afternoon.
I will do.
Thank you. We're going to move along with Atrium. Dr. Mohana, if you can. I'm not sure if I pronounced your name.
Mohanan, no, you did fine.
Oh, good. If you can go ahead and give us some information as an aspect from the healthcare side. What are we looking at? What are the resources? What should we be telling people? I know there are a lot of things going around on Facebook and stuff about how you can contract the virus. So if you can provide some information on that, that'd be great.
Sure. As a physician, you know, we're hearing a lot of different myths and misunderstandings in quite a few communities. One of the things that's really important to understand about COVID-19 or this coronavirus is that no one is spared. There was for a long time a concept that only high-risk people, such as people who are older, people with kidney, liver disease, HIV, you know, a history of cancer, those are the people that would get sick. We now understand that anyone can get sick. People who are high risk are more likely to become critically ill, meaning going to the intensive care unit. One of the concerns that everyone in medical care thinks about is what we call social distancing. And that's particularly difficult in a lot of communities where it's multi-generational, people living in a home or an extended family. So social distancing means that when you're out in public, you are 6 feet apart, you don't touch each other, there's no contact. But what do you do when, you know, you live with your grandmother and your mother and your father in the house, and maybe you have a child as well in the house, or you have a teenager who has an essential job, or you have an essential job and you go out and you come back in. So social distancing is what we do when we're outside the house. When we're in our home, we recommend that people do something called isolation, which is where they don't go out unless it's absolutely necessary. They don't touch each other. They don't touch their, you know, face when they're out in public. They wear a mask, even if it's cloth or a bandana when they're out in public. The other concern is that a lot of people shed virus or can give COVID-19 to other people, but have no symptoms. And the period of having no symptoms can be a couple weeks. So when people go out to the grocery store or work and they perhaps get COVID-19, but they don't have any symptoms, they can be shedding virus. So think about that. So I work in a grocery store, say I work in a grocery store and I'm essential. So I go to work and then I come home and my grandmother's living with me and my, you know, elderly uncle's living with me. I'm shedding virus. So this is our concern for in the home. There are things that you can do to protect yourself, which is, like I said, masking, washing your hands really well, having very good personal hygiene, meaning when you come home, perhaps changing your clothes, thinking about a shower before you touch anyone. A lot of my physician friends are getting undressed in the garage and going into the house with no clothes on and getting straight in the shower. So things like that. not touching your family member, perhaps giving them a room or a bathroom where they can predominantly stay in, cleaning surfaces a lot. And then if you get sick, and this is the most important thing, if you have a fever, a cough, if you have muscle aches, if you lose your sense of taste or smell, the most important thing is to seek medical care. And that's probably the best thing that you can do. There's no penalty for seeking medical care. There's no penalty for getting tested. And most Atrium locations for testing, as well as mobile testing, which we just launched yesterday, are not charging people. So there are options for funding for medical care. So accessing care, seeking out care, being unafraid to access medical care is really important. And I know Atrium Health has significant community partnerships where we are trying to hit hotspots. So these are neighborhoods that aren't getting access to testing as much as we would like. And so we have a mobile testing unit. So, you know, find out where those locations are. And I believe it's on the Atrium website where you can find out where these mobile testing locations are and get tested if you become sick. If you think you are sick, immediately try to isolate yourself at home and report. There's a hotline that you can call, and you can call and find out if, you know, say you have one symptom, but you don't have all the symptoms. There's a hotline that you can call and that'll find out if you need to be tested or give you directions, and that's staffed by medical personnel as well. The other thing that's also really important for a lot of communities to understand is that medical information is private. It is 100% protected by law, and we cannot release that to anyone. You know, you will have filing, not like a filing, but like the health department will know if you test positive, but that's just data collection, and that information is 100% protected. It's actually against the law for us to release information. So if, for example, you have maybe your legal status in the United States is questionable, or it's, you know, pending, you don't need to be afraid to seek medical care. And that's really important to understand for all of our communities. Even if you have, you know, concerns and you say that to the physician, or you reveal to the physician or the medical personnel that you don't have legal status, we can't say anything and we won't say anything. It's not allowed for us to say anything. So the biggest and most important thing is for people to stay at home as much as possible, not touch each other as much as possible, and seek care the moment that they feel concerned that they need care. Does that answer your question?
Yes, it does. Thank you very much. And real quick, I want to get back to Deputy Chief Estes because I know he has another meeting. So I want to make sure if you have any last words or anything like that, anything that you kind of realize that you need to say to the community. Or if anybody has any questions. I don't see any questions popping up for the chief, the deputy, the police department. So I just want to be courteous of your time.
Yeah,
Yes.
thank you very much. I appreciate it. I forgot, as I knew I would. I told you there were two things that I wanted to speak about. One was the external and the other was the internal. Of course, I forgot the internal. So I wanted to say, one of the things that we're doing internally is that, you know, trying to protect our employees the best we can. So we have a very robust and conservative plan, and I think it tied in perfectly with the good doctor's explanation about some of the things that we have to do if we feel sick. So if any of our employees feel ill at all, exhibiting any symptoms, we're immediately sending them home and isolating to make sure that we protect our officers as best we can. So far, we have 4 employees that have tested positive. We're making sure that they're at home receiving medical care so that, you know, we can take care of our employees. So I did want to make that point that while we're trying to do our best to protect the citizens, we're also doing our best to protect our employees. Really do appreciate the opportunity to come and speak with all of you today. Very much. It's my honor and privilege. Thank you.
No, thank you, Chief. Thank you very much. And going back to the Atrium, quick questions. They say that I've heard, and there's one reason why I'm kind of isolated from my parents and stuff, because we're not allowed to go visit them. But how is that? What are the categories that you kind of have to be aware of? I hear that it's always like the kids can't get it pretty much, but they can be a carrier, or, you know, those people with an autoimmune system disease or something. So what are some of those factors?
Sure. So I think a couple things are really important. We've noticed, and children are getting COVID-19. The highest risk groups are newborns. We are concerned about pregnant women, the elderly, so that's anyone over 65, anyone with chronic heart disease, especially if they've had a heart attack or a stroke, people with chronic liver and kidney disease, people who are immune suppressed, so people who have HIV, people who are getting treatment for cancer. And then there are a couple other categories, but it's basically people with chronic illness or people who are at either end of the age spectrum. So what we, and I totally understand your situation. My parents have also been on lockdown, enforced by me since the beginning of all this. And I have not gotten to hug my mother in a month, and it's terrible. Yeah. But it's really important that we adhere to these rules. For example, you can drop off groceries outside, but you can't, you know, you shouldn't come in the house if you've been to the grocery store and walk around with them and use the bathroom and, you know, et cetera, if you can avoid it. I know that in some cases it's not possible because you're caring for someone, you know, physically who needs help. If that's the case, take every precaution. Like I said, isolate yourself as much as possible. Don't go out. When you come home, wash your hands really well. You know, take a shower, change your clothes, clean surfaces, but there are high-risk groups. We may even find out that we know that about 80% of people get a mild to moderate infection, but a moderate infection can be pretty uncomfortable. I have healthy young patients who are in their 20s and 30s that don't have medical problems, and they tell me that, you know, day 7 through 10, they feel like they got hit by a truck, and they were doing everything possible to avoid going to the emergency department. So it is not, for most people, even though they don't go to the hospital, it's not easy. It's like the worst flu you've ever had. And nobody wants the flu to begin with, but this is like the worst flu you ever had. So it's really important to protect our vulnerable populations because they go a step further. They don't just have the worst flu they ever had or the worst, you know, viral illness they ever had, but they usually get hospitalized. A lot of them get put on vents. They get pretty significant problems with breathing and even with heart issues. So we just want to be really protective of that. The other thing that I hear a lot is, can my pet transmit it? Because of that tiger, I guess there were some tigers that got coronavirus. Your pet cannot give you corona. There's been no case of an animal transmission to a human. That being said, don't go to the groomer. You know, if you have a vet emergency, that's fine. Try to keep your animal in the same place. For example, if it's a yard animal, like you're in your backyard, keep your dog there. If it's an inside cat, keep the cat inside. There's no need to go to other neighborhoods. You should walk your animal if that's what you're doing, but you should stay away from people. You should mask when you walk your dog. You should go outside and get exercise, but you should be careful about interacting with people. You should maintain distance on the sidewalk. And then the other really important thing is food. I've heard from a lot of people this myth that if you touch food, it can transmit corona. We actually have not had cases of food transmission. So it is safe to order food from restaurants, to get takeout, to, you know, pick up food from other delivery or get delivery. But you should still also try as much as possible to eat at home, to prepare your own food and follow all of the hygiene guidelines. That being said, you know, that's another thing. I haven't eaten my mom's food in a month. So I think there are cultural things that you miss, but it's just really important, and it's a difficult time, but it's really important to follow the rules. I think we need to understand that following the rules are actually reducing new cases. And I know it doesn't sound like that from the media, but North Carolina is, like they say, flattening the curve. We are starting to see that the spike is not as aggressive, or we're hoping that the spike or the surge is not as aggressive as we had originally feared. And the further we can push that curve back, the less pressure and the less fatalities we will have. So that's also really important. It is very difficult. And I always want to make people and families understand this is really hard, but do it anyway. And there's no way to convey that to kids who are at home all the time, or maybe, you know, like I have a lot of difficulty sometimes explaining to my dad, like, no, you can't go to the grocery store just because you need one thing. You need to stay at home and I will bring it to you outside and I will drop it off. So those kind of things are very difficult for families to understand, but they're crucial. They're probably the most important thing that we can do, because I want to remind everyone, we don't have treatment. Everything we have right now is experimental. We don't have a vaccine. We only have prevention and treating symptoms. So there's no cure. There's very little we can do if you get critically ill other than treat your symptoms. So let's just not even get sick. That's the goal. Does that answer your question?
Yes, it does. Thank you so much. Thank you for being on the call. And,
Of course.
and real quick, we're going to go to our last panelist, Lynette McCullum from 311. And basically from your point of view, I know 311 is getting the bulk of the calls. I work at the call center too. I kind of volunteer there. So from your perspective, what is 311 doing right now? I think they've kind of shifted their role a little bit, aside from their everyday answering questions for the citizens here in Charlotte. But what do y'all see in 311? What do you suggest us letting people know about when to call 311? So if you would like to discuss on some of that.
Okay, thank you. I definitely appreciate this opportunity to discuss 311. We are still continuing to provide information concerning regular services related to city-related information and also some county information. We've worked with different departments, you know, such as solid waste, CMPD, Mecklenburg Park and Recreation, and Mecklenburg Tax Department, just to ensure that we provide the most up-to-date information. I believe the call center that you're referring to, we do also have 311 staff that is working with the with CMPD as far as the stay-at-home order. We do have our staff is able to take, if we have residents that want to call in concerning the stay-at-home order, concerning any type of violations as far as like price gouging, or if they notice any public gatherings or any type of stay-at-home violation, we are able to record different requests for that. So we have transitioned a little bit differently, but we still are providing the same services. We are still open Monday through Friday, 7 a.m. to 7 p.m. I also just want to make sure that along with calling 311, we also have other options because our call volume has increased during this time. So we do have other options such as our CLT Plus. That is a mobile app for your phone. It's available for both iPhones and Android, and it allows you to quickly access and enter. But there's about 20 common service requests that we receive. We also have a live support chat option that is actually located on the city webpage, which is charlottenc.gov, where it's an actual icon on the page where you're actually able to kind of communicate with an agent if they're available, and kind of use that as another option as a way to contact and get in touch with 311. And then we also have our online service requests where times if you're not able to call in, or if you're wanting to, do an online method, not actually speak to someone, we do have service requests that you are able to enter in that way. So we definitely have seen an increase, and you still can call 311 as far as if you have questions. We still provide information if you have questions concerning any trash pickup, if there's any questions concerning your water billing, tax billing. We still providing our regular services as far as providing information, but we also have included, if any type of violation reporting for the stay-at-home order as well. So we are still providing those services. I'm not sure if that answered the question.
It does. It does answer the question. Quick follow-up. What type of complaints? You say the stay-at-home violations. What kind of violations are you talking about, or have y'all seen that are come in? And also, do you have Spanish speakers on the 311, or how, if somebody that does not know English, how can they communicate with the operators there?
Okay. Yes, we did the type of kind of violations that we've seen. Just the ones I mentioned, the price gouging. If you've seen any type of pricing that you don't think is correct, any type of public gathering. I know right now, if it's 10 or more, that can be considered a violation. So we have seen those type of violations reported, and also any violations as far as with the stay-at-home order. If there was any type of questions as far as concerning any type of essential business, some of the things we are able to answer, but we can at least go ahead and at least put in a report. These actual requests are being tracked through CMPD, so we are able to, if there's any type of question or any type of anything you think that may be a violation, we can definitely record it. And then, they research it on their end. We do have staff that is bilingual. We also have staff that is working at the stay-at-home with the hotline that is working as bilingual as well. We also have access to what's called a language line. So along with residents who, may be Spanish-speaking and other languages, we do have access to that as well, so that we're able to assist our residents.
Thank you. Thank you so much.
Okay.
So for the 311, you say garbage pickup. Are you like the first place that citizens and residents should be contacting if they have questions about city services, or what does that look like?
Yes. So say, for example, for garbage services, if there's any type of questions about collections, if your recycling day, what day your services, we are the actual first point of contact for solid waste services, and a lot of the other city departments. Okay.
So 311 is like the main number that we should be calling for any type of city services, and then from there, I'm assuming y'all can direct us to any other department or anything.
That's correct. A lot of the times we are the first point of contact. We do enter service requests for different departments. If it's a question that we are not able to answer directly, we can get in touch with either that department directly, or enter in a service request so that that department will get back in contact with you.
All right, perfect. Thank you so much. Real back to you, Dr. Mohan. I have a question that came in. They said about asthma patients. Is there anything particular that people with asthma should be doing now?
So anyone with chronic lung disease, like I said, chronic lung and heart disease especially, is definitely higher risk for complications of COVID-19. Asthma patients in particular, I think are very important. It's very important for us to clarify symptoms, especially because of allergy season right now. So a lot of asthma patients just have a cough all the time, or have allergy symptoms that are worse this time of year. So I think it's really important for asthma patients or patients who live in really high pollution areas, for example, to, if they have symptoms, to call their primary care doctor, or to call the hotline and make sure that it's not anything more severe. I do have quite a few patients who have things like asthma, COPD, emphysema, or what happens after years of smoking. When they call, I'm very careful to screen them for questions that put them either at like, maybe this is your asthma flaring up, or is this a concern for COVID-19? So asthma patients just need to be really careful of their symptoms and pay attention to themselves, and pay attention to their symptoms, especially during allergy season. It's the same thing for chronic allergy sufferers. It's very hard for the average person to make that medical decision of, oh, this could be something mild, or, oh, this could be something severe. So at Atrium Health, the hotline, looking the symptoms up on the Atrium Health website, calling your doctor, and always go to your primary first, because that's sort of your first stop. Obviously, we want people to not come to the clinics as much as possible, But we're still taking new patients. We're still doing phone visits. We're doing virtual care. There's also at Atrium Health something called a virtual hospital, where if you're sick, but you're not, and you have COVID-19, but you're not sick enough to need the hospital, we can come to you and assess you virtually. You can stay in your home. You can avoid complications or any of the other chronic illnesses, but we can at least assess you at home and make the decision if you need to go to the hospital or not. So, you know, use your primary care doctor. And if you don't have one, we're still taking new patients. We're still taking unfunded patients. That's something that Atrium Health has been committed to in our community for the entire duration, back when we were Charlotte Memorial Hospital, then Carolinas Medical Center. So we are still committed to the communities, regardless of language, regardless of culture, race, anything. This is our community. So access your primary care doctor or try to get primary care as much as possible.
Thank you. Thank you so much. Real quick with 311, we're underneath the Mecklenburg County stay-at-home order until the 16th, which is tomorrow. After that, what happens? What are our options? What are we doing?
Well, as far as what we'll have to wait as far as to get the additional clarification from the, I believe that's from the governor, as far as, I know with the Mecklenburg County stay order as well. So we anticipate additional information will be provided with that. But once we receive that, then we will move forward. If we can, continue the services we have, or if there are any changes, then we will relay that information.
All right, perfect. So the best point, aside from looking at the media or anything like that, maybe call 311, especially the businesses that are wanting to open up on the 17th.
Yes, and in that case, there also is a hotline, a stay-at-home order hotline. If there's questions specifically as far as what will be the next step as far as the stay-at-home order, then that would be the best actual contact for questions as far as what to actually continue.
Okay. And what is that hotline?
Hold on just a moment. I can get that for you.
Okay. And also, doctor, what is that hotline that you had mentioned a few times?
It's actually the Atrium Health. I'm actually looking it up while we're talking.
Okay.
I will post it as soon as I find it. It's a Atrium Health Central number. I'm sorry.
No, that's fine. And real quick, what about people from other counties like York or Cabarrus? Can they come in, and if they're in Charlotte for work or whatever, can they be tested at the mobile sites? She might be looking up that number, but we're going to be asking that question in a minute. Real quick, while they're looking up numbers, if anybody has any questions or anything, please write it in the chat box so that way we can make sure we ask the panelists. Hopefully all this information is good. Faith, real quick, do you have anything, or does the city have anything? Charlotte Works will be the person to kind of go through if there's like the small businesses, and a lot of the minority businesses have been affected with this COVID-19. Would they have the resources about that federal funding, the loans and stuff?
I do not think so, but I'll double check. And I can also reach out to someone in economic development to see if they have that information in terms of the loans and stuff like that.
Okay, perfect. Do we have the hotlines?
Just a moment. I'm looking that up right now.
Okay.
So if you didn't ask me, I could tell you, but I am looking that up right now.
All right. And actually, Doctor, I think your coworker Rita has told us the hotline for Atrium hotline is 704-468-8888.
Yes, I just found it. Yes, that is correct. But I also would like to tell people there is a COVID-19 assessor on the Atrium Health website where you can actually start. It's in English, and I believe they do have options for language line if you call the hotline. But this is just something you can access on your phone, and you can put in your symptoms and go through the risk assessment, and they will actually tell you if you need to call the hotline or not. And that's atriumhealth.org. And that's just on the patient the person, the community facing page, and they can actually look it up easily. And then that can help them decide whether or not they need to call the hotline or seek emergency care or get tested. So you can actually do this at home before even starting, to call your doctor, et cetera, et cetera. And that's, again, atriumhealth.org.
Thank you. Real quick question. I think you were looking for the hotline. We had a question come in that if other people from, if they happen to be working here in Charlotte, if they can go by the mobile sites to get tested, if they feel like they might need to get tested.
Yes. So anyone can access the mobile testing sites. I actually just got the schedule. The next one is tomorrow at First Baptist Church West from 10 a.m. to 4 p.m. And just for a clarification, the phone and online risk assessment is available in Spanish as well. So anyone can get tested, and there is, if you're not funded, there is a way to get testing without getting a charge.
And that's for anybody even if they live in another county.
I believe so. I think it's just access to testing no matter what. I don't think there's a geographic restriction for testing.
Okay. Do we have the hotline for yeah.
We do have it. It is 704-353-1926.
Okay, perfect. And that is the stay-at-home hotline, right?
That's correct.
All right, thank you. Any other questions from anybody any last suggestions, comments, or anything from the panelists? All right, if not, we're actually gonna finish early. I like these online things. I think it's just because we don't have our breakfast, and I truly do miss seeing everybody and having that interaction and networking with everybody. But hopefully, as long as we're in this situation, I think we're gonna start doing this a little bit just to connect with everybody, to make sure everybody is up to date with any information. Quick reminder, this afternoon at 5:30, we're gonna have the Spanish version of this panelist forum type on our Facebook page, Enlace Facebook. So please let your consumers know. So real quick clarification. There was a posting by one of our city council members that the testing is a cost. There's a cost to the testing. And you're indicating that it's free, doctor?
So it is covered by insurances and Medicaid, as well as several of the sliding scale fees, but you can also get tested for free. It just depends on the assessment when you go to get tested, and they'll get that information from you, but cost should not be a restriction for getting tested. This is a public health crisis, and it's more important that we find out who's ill and that we get them care. So Atrium Health is not, there are options for no charge testing through Atrium Health.
Okay, perfect. Hopefully that answered that question. Again, thank y'all for being on the Enlace meeting hub here. We're gonna get that information sent out to you as soon as the panelist sends us information in the chat box. I did wanted to make sure that the hotlines were in the chat boxes, so that way you can write them down and everything. Also, what I'm thinking is that I did record it. That's why I wanted to make sure only the panelists were the ones that had the video. We're going to try to post this recording on our Enlace webpage, so that if you want to come back and you weren't sure about some information, or you want to share this recording with a coworker or something that was not able to get on the phone call this morning, you'll have that access on the Enlace webpage. Just give us a few days and just check on our website, enlacecharlotte.org, so that way we can make sure that we have all this information updated. So if there's nothing else, I would like to thank the panelists again for being on the call with us. Thank you for the information. Great information here.
Thank you.
Okay? All right. Have a good day, everybody. Okay. Thank y'all.
Bye-bye.
You too. Bye-bye.
Bye.